So when you look at how noise affects the infant at a biological level, the most significant findings you'll see is around autonomic disturbances. So the human being is developing in utero, and it's not like it's as quiet as a church inside. There's lots of sounds inside. There's borborygmi, or bowel sounds. There's vascular sounds, the sound of blood swishing through blood vessels. There's valve closure, obviously the heart beating, that lub-dub that you're hearing. The baby listens to that continuously, and even respirations. So it's far from quiet inside, but the noise environment inside is of low sound frequencies. And as the inner ear, the hearing apparatus develops, the first thing that develops are those low frequency sensors, those inner hair cells that are responsible for lower frequencies. And the higher frequencies develop later on in gestation. And so if you're a premature person, when you first come out of the womb, you're exposed to a lot of high frequency sound waves, and these can be really damaging on these fragile structures that are still developing in the inner ear. Think about yourself. You're homesick from work and you've got the flu, and the kids come home from school and they bring half the neighborhood with them, and they all come screaming through the front door as you're moaning and groaning on the sofa with the flu. Your symptoms are exacerbated just from that noise stimulus. So think now of the baby. We're back in the NICU, and this poor little soul is used to, low frequency biological sounds and not all these high pitched noises. And you come in and you're chatting with Nurse Sally, and you're chatting with this one, and the alarms are beeping off. They're already not feeling well because of whatever their primary pathology is. You're actually exacerbating their experience of stress associated with their condition just by increasing the noise in the environment. Those high frequency sound levels activate a stress response within the baby, and that's registered at the brainstem level. And so what you'll see is you may see tachycardia, you may see bradycardia, you may see pauses in breathing just from this external stimulation that the infant's receiving from the noise environment. But it's compounded by a bunch of other stressors as well. For example, excessive touch and the painful procedures and challenges in breathing and that sort of thing. Even if you're just walking down a busy New York sidewalk and there's lots of cars and lots of noise and all that other kind of stuff, it can become very overstimulating. You may not even be aware of it because it's happening at an unconscious level. There's some really cool work that was done looking at auditory distraction as a phenomenon, as an outgrowth of babies that had survived the NICU, but then we're seeing that they're having these behavioral manifestations, that they're more frequently being diagnosed with ADHD, and a component of that population actually suffers from auditory distraction, where their hearing has developed at this decibel range that is higher than normal. So in order to get their attention, you have to speak at an even higher decibel level. We just need to use our church voices or use our library voice to really, protect their developmental potential. The things that happen during these early periods of life affect the development over the lifespan.